Welcome all to the webinar on FAO's Evet mobile application, real-time disease reporting to enhance surveillance and early warning system. My name is Ismail Sek. I'm leading the early warning team at HQ, FAO, and will be moderating today's webinar that is part of the webinar series we are organizing through FAO to enhance surveillance and early warning system. We are pleased today to join us, but for those who will be able to join, a recording will be shared later. During the webinar, we will have 25 minutes of presentation and then open the floor to questions that our panelists who are here today will be more than pleased to really answer. We have connected today here, joining us as panelists. We have Dr. Gisela Joa, who's really the EMAi implementation coordinator. We have Dr. Fernanda Dorea, early warning and data mining project manager. We have Amy Delgado, the senior veterinary advisor. We have here Kauri as an animal health officer, Dr. Sabina Ramazato, information system analyst and also developer from CSI. We have Dr. Frederic Keveria, the regional epidemiologist and EMAi focal point for East Africa, East and South Africa. Dr. Marcel Boca, regional epidemiologist and EMAi focal point for West Africa, Western South Africa, and supported by Dr. Gaiba Maina, who's the Ghana country team lead and EMAi focal point. We have also today the Dr. Hassan Arekal, the acting executive director of the Regional Animal Health Centers at ECOWAS. You can share your question by clicking on the Q&A button, and also type your question while really the webinar will go. Please note that this webinar is being recorded and it will be shared afterward with all. So without any further ado, I would like really to begin this by passing it over to Maru Dingra, the Senior Animal Health Officer and leading the Animal Health Prevention, Preparedness and Rapid Response Cluster at FAO, who will be making the opening remarks for us today. Please, Dr. Madur, the floor is yours.
Thank you, Ismaila. Can you hear me clearly?
Yes. Yes.
Okay, great.
Yes.
Okay, so good morning, good afternoon, good evening, everyone, depending on where you're joining us from. Very warm welcome to you all, and thank you for joining this second webinar. This webinar is part of the series of webinars that we are having on enhancing surveillance and early warning systems. So it is part of the animal health webinar series. We had an introductory webinar about a month ago, which gave a broad overview of the work that FAO does to support its member countries in enhancing surveillance and early warning systems. And today's webinar will specifically focus on the FAO's event mobile application, also called as EMA-i Plus. This is a real-time disease reporting mobile application that is used for enhancing surveillance and early warning. So within the FAO's Animal Production and Health Division, we support members' capacities on improving disease intelligence and decision support through providing tools, platforms, guidelines, and frameworks for this area of work. And through the work that we do, we contribute to sustainable livestock systems, but also enhancing One Health in agri-food systems. So this webinar series aims to provide a forum for information and discussion regarding the support offered by FAO's animal health programs. So in this webinar today, we will, as I mentioned, focus on EMAi Plus. This mobile application is currently supporting countries in improving real-time disease reporting and digital disease information capture. And it enhances early warning and epidemic intelligence. So this webinar is a space for dialogue, for knowledge exchange, and also for capacity building. So we encourage that you participate actively. You spread the word about this to any of the stakeholders who might be interested in knowing more. And please do share your thoughts during and after the presentation. So our objective is simple. We want to work with countries. We want to empower countries with practical, scalable solutions that strengthen animal health disease intelligence. And together we can build more resilient surveillance systems that protect animal health, that safeguard productivity, food security, livelihoods, and contribute to global health. So we're very happy that you are here and wish you a good discussion. Back to you, Ismaila.
Great. Thank you. Thank you so much, Dr. Madhur, for those encouraging remarks and showing really how through this cluster you are able to support country enhancing their surveillance and early warning system. Now, I will hand it over to give the floor to Gisela, who's really the EMAi implementation coordinator to present the FAO event mobile application real-time disease reporting to enhance surveillance and early warning. Gisela, please, can you share your screen?
Certainly. Hi, thank you, Ismaila. Let me quickly share my screen. Go.
And please, if for the participant, you can really use the Q&A, the chat box to ask your question, if any you would like to get some clarity while Gisela will present.
Sorry to interrupt. We seem to be having technical difficulties with the chat, but the Q&A is open. So we apologize for that. If the chat's not open for you, the Q&A is. So you can write on the Q&A and we'll do our best to answer. Apologies for that.
Thank you, Nanda. I was actually about to say that before starting, but yeah, I apologize also for this technical issue that has come up. So as mentioned by Dr. Ismaila, I would like to present to you some information about our event mobile application, EMA-i Plus. Hopefully you can all see my screen. So this presentation today, I will give you some context, of course, about how EMA-i fits into the overall work of FAO. Then I will explain what is EMA-i, what is EMPRES-i Plus, how does it work, what are its advantages, and so forth. And then I will also give you some insights of where we envision ourselves for the future with EMA-i Plus and EMPRES-i Plus. So in terms of context, FAO has a mandate with animal health to help countries to improve their capacity to prevent, detect, and respond to high-impact transboundary animal diseases, zoonosis, and other threats of animal origin. And within the activities that we support for this, a core activity is that related to early warning and surveillance to enhance early action and response. We also have a priority program on One Health that precisely under this program, we work on improving early warning systems across the globe, bettering biosecurity for pest disease management, improving more effective emergency preparedness response, heightening AMR risk management, enhancing One Health systems, improving global health security through the One Health approach, all this to globally strengthen One Health and therefore contribute to meeting the Sustainable Development Goals of the United Nations. So when it comes to improving early warning across the globe, we focus our work considering definitions by the United Nations Disaster Risk Reduction Office that defines early warning system as one that has a set of capacities needed to generate and disseminate timely and meaningful warning information to enable individuals, communities, and organizations threatened by a certain hazard to be prepared and then to be able to act appropriately in the sufficient time to reduce the possibility of any harm or loss. What are those key elements that are needed for a good early warning system according to the UNDRR? That includes the capacity to actually detect the threat, of course, knowledge on the risks through regular and systematic collection of data and risk assessments, analyzing and forecasting risks and their possible consequences, and then, of course, disseminating and communicating all that information to allow for timely action and to be able to prepare to respond adequately. And translating that into our animal health world, we recently developed a framework for early warning where we visualize this as meaning that we, of course, need to work at all levels, national, regional, and globally, to be able to get data in a timely and sufficient manner through surveillance and early detection mechanisms, and also through monitoring and forecasting of risks. And all this would, of course, then need to be digested for proper communication and delivery of information to decision makers to then take the adequate action based on evidence. And basically, EMA-i, where this fits into, is precisely in improving the surveillance systems, and being able to get timely and adequate information. So at global level, how do we do that? At global level, we work on improving early warning systems by tracking rumors with technologies such as the iOS, which is a mechanism to track rumors through media sources. We also have a EMPRES-i global system where we also track open information, usually from WAHIs. We pull information from there, but also from iOS and from information shared with partner organizations through our GLUES platform, so with WOA, WHO, and UNEP. And we also consider information from some modeling and forecasting tools that we have. Specifically, we have one that we've been working on for years on Rift Valley fever, and more recently, we've been working on a model for forecasting highly pathogenic avian influenza. And so we capture all these signals at global level to be able to get to digest this in rapid risk assessments and then allow for something odd, for early action. But this, of course, all this work that we try to do at global level, we cannot do if the countries don't have mechanisms to actually be able to quickly detect these diseases, to quickly do early detection and surveillance of their country. And because of that, apologies, there seems to have been an issue with my computer. I think we're okay now. So because of that, we developed EMA-i application, which stands for Event Mobile Application, which is a real-time, it's simply an app that allows for real-time disease reporting that then field agents can then report such events in real time without having to be done on paper or anything like that. And then that data is stored in a cloud and can be easily visualized and accessed by the veterinary services in a dashboard. And we most recently developed a new version and launched it in 2024 that we now call EMA-i Plus. So how does it look like if you actually open the app? Here on the left, you see how it would look like if you open the app on your phone, and on the left, if you open it on your desktop, the dashboard that I was mentioning. So the app, apologies, there seems to have been some issue with my slide. There was one before this one. There we go. So the way the app works is basically you are able to collect data, as I mentioned, in the field, directly in your phone, in this application, And then this data can be stored offline if you are somewhere in the field that you don't have internet connection. When you arrive in a place where there's internet connection, that is then uploaded to the app, to the cloud. That then can be validated at central level by the veterinary services to ensure data quality. And that data, of course, then is stored in a confidential workspace in the cloud and can be used for analysis, and even does some automatic analysis and generates automatically some figures and graphs that the country can use to then share information with decision makers for early action. And now we're more and more working on including and connecting this application to other applications as well, that I will talk to more ahead. So as I was saying, this is how the app looks like if you open it on your phone. Basically, on your phone, it's how it looks like on the left, on your phone or your tablet, and then on your desktop, it's how it looks like on your right. As I mentioned, so the officer in the field can create a new event. That event can be uploaded later in the app if they don't have access to internet. Then that can be accepted at the relevant level in the country if that event that was created, the information inserted is complete and is adequate. If it's not, it can be sent back to the event creator for including more information. And then once it's been properly filled in and it has been accepted, it is sent at central level to be confirmed, validated at usually central level, often using laboratory confirmation, and that information can also be included in the application. Here, just to show you a bit the form that is used when creating an event. As you can see here, the app automatically identifies the GPS coordinates of where the event is being reported. And beyond that, the reporter can include not just the location of the event, but also the onset date, observation date, the species of animals being affected, type of animal, domestic, wild, the type of production system, and even specific information about the case, such as the animals at risk, the actual cases, number of deaths, clinical signs, and so forth. Also, they can put information on any samples collected, when the sample was collected, the type of test that is expected to be done with this. Then once the results of the lab arrive, you can also include the information of the diagnostic confirmation, and can also include information on any treatments done with this case, any control measures implemented, and also you can upload photos of the case. And as I mentioned, then all this information is put in a database in the cloud that it has access only to the veterinary services, and the application allows for automatic data analysis and already generates automatically some graphs, some images that you can see here, some examples on the right with fictional data, just so you can visualize a bit how it looks like. And you'll also notice there's a little button here that says event near me. So with this application as well, the users can see events happening in their region within, of course, their country, since, as I mentioned, all this information is limited, is confidential to the country using it. So why use EMA-i? Well, as I mentioned, it allows for real-time reporting of animal disease events. It allows then the country to customize the flow of how that event is reported, accepted, validated, according to their own context, according to their own structure of their surveillance system. It automatically generates epidemiological analysis and visualizations to make it easier later on to make reports and communicate that information to decision makers. It also makes it easier, as I mentioned, to report events and validate it in the system. It also creates a national database of events in a secure cloud-based platform with no maintenance fee for countries. So since this is stored in a cloud-based platform of FAO, there is no maintenance fee that is covered by FAO. And we have a team of IT experts who support the users of this for any troubleshoot issues, and of course keep the system up to date with the latest technologies, latest versions, without also any additional cost. This is within the cost of FAO after the country has adopted the application. And overall, of course, it would enable early detection and response to disease events. Now, this has been used until today in several countries, especially in Africa, in East, West, Central, and Southern Africa. But also we've been more and more expanding into other regions of the world. Most recently, Iraq has started using this application as well. And we've been working with some countries that have also shown interest in this application in Latin America and the Middle East. And how has this helped countries that have used it to date? Well, all these countries that I've mentioned have mentioned that it has greatly boosted the notification of events and reduced the time between the onset of the event and the reporting, the notification of the event, with some countries even reporting that they've seen a 10 times increase in their monthly reported disease events compared to before using the app. Also, as I mentioned, it helps country to make weekly and monthly epidemiological reports because of these automatic analysis and visualizations it makes, and also because it organizes the information nicely that can be downloaded and used for analysis as well. It just makes it much easier, countries have told us, to do their epidemiological reports, do their analysis. It makes it easier also to share information with One Health partners, because again, since the information is organized in a nice database that can be downloaded, and reports can be made with that can be shared as the country sees fit with their One Health partners, with the public health sector, environmental health sector. But also in one country, we've been working on a mechanism that allows for immediate notification between EMA-i and the public health similar application called geo-referenced through email and SMS messaging. And some countries have also been using this application for disease to be reported from the wildlife sector and also private veterinarians, since it's quite simple app to use. So they've been able to also incorporate reports from these sectors, improving the capture of data from different sectors. There's a country also who mentioned that this application has also allowed them to more easily get data information that they can share with universities, with research institutions for research and better understanding diseases in their country. And also the application we've been using has mechanisms in place that we have been improving more and more to be able to capture also syndromic and community-based surveillance data through other mechanisms such as Kobo tool that can be connected to this. And more recently, we've been working on integrating a specific application that is for syndromic and community-based surveillance called AFIA data. So what do we envision for the future? So for the future, our idea is precisely to, beyond just the dashboard that we have for EMA-i, where you can see the events created in EMA-i, to actually help countries within it, within this EMA-i system, to have a national platform where they can integrate different sources of data, different flows of data into different surveillance components in their overall surveillance system. So they can, of course, capture their data from their EMA-i passive surveillance reporting, but also from active surveillance, from syndromic surveillance, from the different types of flows of data that there might be in the country. So as I mentioned, then there would be what we would call an EMPRES-i national platform, where you would get all this data, like I mentioned, from, say, EMA-i that we already captured, but also from active surveillance, from laboratory, directly integrated into the application, from community-based, such as AFIA data. We're now working on actually integrating the data captured in that application into EMA-i as an option for countries, from GHSI2, syndromic, rumor tracking, whatever kind of data that the surveillance system in the country captures. So this can all be in one platform that countries can then easily access and manipulate and manage. One thing I want to make very clear is, I mentioned in the beginning how we have our EMPRES-i global platform, which is different from the EMPRES-i national platform. They have the same, let's say, structure, it's the same family of tools, but the EMPRES-i global is a public website that we have here at global level, where we gather information that is not confidential, that is open, usually from sources like WAHI's, the official reporting of WAHI's database, from from media outlets and so on. So public data is gathered in EMPRES-i Global. Anyone can access and see the events there. It's not confidential. However, then we have the national EMPRES-i database that is the place where EMA-i information is stored for the country, that only the country has access. FAO does not see this information. We are not able to see this information. So beyond this future platform that we're mentioning that we're working on for countries to have to integrate different types of surveillance data, we are now finalizing an online course on EMA-i, on how to use EMA-i in our FAO Virtual Learning Center. This would be a modular online course, as I mentioned, how to use EMA-i and EMPRES-i National. That has a comprehensive learning approach with short micro videos of 2.5 to 2.5 to 3 minutes, with a total of about 2 hours for learning content. And the idea really is to have a course that is interactive, designed to reinforce the learning and enhance user engagement with EMA-i and EMPRES-i platforms. And the course can be done either on your phone or on a computer. And it would be used by future users or actual users of EMA-i to know how to use it. And this can be combined with some in-person sessions to make sure that we can translate what is learned online into the actual scenario in the country into practice. And it also includes some scenario-based exercises to simulate some outbreaks in a farm and how to use EMA-i when you have an outbreak. And beyond that, we are also incorporating into that online course a community of practice where participants, users of EMA-i, can exchange experiences with the application. And in that context also, we are now, in order to help us expand our capacity in FAO to support our various member countries who could be interested in EMA-i and EMPRES-i Plus, we are planning some training of trainers for FAO colleagues here at headquarters and in the regions sometime in September, October, so that they can also know how to support countries who request EMA-i and then have better capacity to support these countries. So keep an eye out. We will soon be sharing the save the date for this training of trainers for FAO colleagues in headquarters and the regional level. So if you're interested in EMA-i, if you'd like to know more and discuss perhaps if it could be useful and relevant for your country and sustainable as well, please feel free to contact colleagues in your respective FAO country office or regional office. And we are more than happy to arrange follow-up calls to discuss further and explore further the idea of possibly having that in your country. But you can also contact us through these emails here. Here we have our various focal points, not only for EMA-i, but also for other topics that we work with, that we support here at FAO. Specifically for EMA-i, you can contact us through our dedicated email, emai@fao.org. And in East Africa, we have our focal point, Frederick Kivaria, whose email is here that you can contact. In West and Central Africa, we have our focal point, Dr. Marcel Bokak, who can also be contacted in this email. And in general, for the various activities that we support in FAO related to early warning and surveillance, you can contact us through this empressanimalhealth@fao.org email. So with this, I end my presentation. Thank you so much, everyone. I hand it back to you, Ismaila, to...
Yeah, thank you. Thank you so much, Gisela, for this comprehensive presentation. I'm seeing a lot of interaction on the chat, a lot of questions. And just to inform our colleagues, then you can click on the Q&A bottom at the bottom of your screen to really, for your question, and we will be happy to continue to answer to that question. I see some questions already start to be addressed, and I don't know if, for example, our colleagues from the region covering really Western South Africa and South Africa, like Dr. Frederike and Garba Maina, if I see a lot of questions and colleagues asking a little bit some challenge related to the reporting on animal disease and how EMA-i can help to resolve that one. And here is more for under the country perspective that have already or country already implemented EMA-i. What were the key lessons learned, the recommendation that should really be considered, especially in terms of training, adopting the tool? I am seeing a lot of interaction on the chat asking how we can move from the old to the new one, how we can really establish, implement this system at country level. What about the quality of data? There are a lot of questions. I don't know, Dr. Garba and Fred, if you can provide your feedback depending on really the lesson learned on the implementation of EMA-i at country level. I will start with Fred, if you want, after Garba will come on it.
Well, thank you, Ismaila, and good afternoon, colleagues. Greetings from Nairobi. My name's Frederick Ibaria, and I serve as a regional epidemiologist for the FOU Animal Health team based here in Nairobi, covering Eastern and Southern Africa region. And with respect to the question, I'd like to maybe talk of at least 3 points. Number one is the issue of training in terms of lessons learned. Number one is the issue of training. The feedback that we received from the countries emphasizes on the need for continuous training, which is tailored to the local context. And therefore, this comes from the observation that one training is insufficient, and therefore there's a call for a continuous training. And one way to achieve this as part of the recommendation is to promote what we call peer learning, and ensuring that we have a program of ongoing capacity building, and also importantly to make sure that the learning materials are in local languages. Because, for example, when we are dealing with the pastoralists, community animal health workers, the language they know is either the local language or limited technical language. So if you have the training materials customized or tailored in the local language, the learning becomes more efficient. And in terms of adoption, what we learn is in places where community animal health workers were the target for training, were the target for using the EMA-i, the success were big. And here we are talking of places like Karamoja in Uganda and the Maasai land in Tanzania. We are talking of Arusha and Manyara. One of the recommendations that came out clear, because providing training involving public veterinarians is good. However, they have so many roles to do within the government machinery. So in most cases, they're unable to follow up on issues on the ground. However, where we have trained community animal health workers, we have seen a lot of success. And therefore, this calls for the involvement of private sectors, and in a way, involvement of community leaders to ensure that things are happening on the ground. And also, one of the key factors that we have observed is the need for providing incentives, not necessarily in terms of money or data bundles, but at least in a month or in a quarter, providing feedback that Frederick Kibaria is the best reporter for this month. That encourages a lot in terms of following up issues on the ground and make sure that the surveillance system is active. On the other hand, when it comes to data quality, one of the key advantages of the EMA-i system is the fact that the timing of reporting is timely, and also the quality has improved. However, we had one of the challenges is in terms of the reporter receiving feedback. For example, when they send the report, there's some what we call incomplete entries. Now, if you give them feedback on these incomplete entries and retrain them on how to address these issues. In terms of feedback, we have seen a lot of improvement. And therefore, one of the key recommendations here will be to make sure that we provide regular quality check and feedback. Allow me to stop here, and I'm more than happy to answer additional questions. Thank you.
Yeah, great. Thank you so much. Thank you, Fred, for really sharing your experience and also lesson learned, and happy to see that great recommendation. And I think it's really important to really support and the adoption of the EMAi in that region. I will now give the floor to Dr. Garba. I don't know if you can hear us, to share a few perspectives from Western Central Africa. Dr. Garba, you are with us?
Yes, I'm here. Can you hear me?
Yes, please, loud and clear.
Okay, sorry, I'm in the field and it's a bit noisy. My internet is not so stable, but yeah, just to add to what Fred has said, I think for us in the region, in the Western Central Africa region, EMAi has been a game changer because it has provided us the opportunity to capture real-time data. And not only that, a lot of outbreaks that are happening in the field have been reported through the EMAi system. So that is quite a positive development. And one of the things that I have seen also in the new EMAi Plus is the fact that, you know, the various levels of check in terms of data quality, you know. So for example, in Ghana, we have it at the community level where the community animal health workers are using this system to report. And these people are also supervised by the district level officers. So there's some kind of interaction within that segment or within that flow of information. So there's always check to make sure that once the quality of the data coming from that level and the interaction that happens, it goes then to the other levels, the regional and the national. And this has provided an opportunity also for the first time to have a system that enables supervision of the community animal health workers. In some of the countries in Western Central Africa, you have a lot of community animal health workers, but they don't report to the system. So when you have this system that allows the vet services to also monitor what the community animal health workers are doing at the community level, I think it provides us with better quality data, and they are at the level where events are happening. So they report. In Ghana, we had a unique experience where we were liaising with an NGO that was training 70% women, and they have been reporting using this tool because they own the animals. Anything they see, they try to report. But there's always an officer to screen and see what they are reporting before this is taken to the next level. So I think these are some of the positive things that I've seen with EMAi. And also in terms of sustainability, maybe it's time to get away from the issue of providing mobile phones and the rest for sustainability reasons. So everybody has an Android phone, they can download and use it for their normal work. So that is also something we should think about. These are just the few things I wanted to add in addition to what Frederick said. Over.
Yes, great. Thank you so much, Fred, and also Garba. I see on the chat a lot of interaction related to how the system is really connected with other system, the interoperability, how it links with the WAHIS and from WOHA system, how the reporting will work. And that will bring to me to introduce Dr. Fernanda to ask and address some EMAi continuous enhancement at global level, and to try to come up with all that question raised related to all the development side, the interoperability, and how it link with to enhance the digital surveillance system and reporting. Fernanda, please, can you you have the floor to address that.
Thank you, Ismaila. Thank you. And thank you for allowing me to use this question to give a bigger and broader view on interoperability, because I see that there is a lot of questions in the chat. So EMAi was developed having in mind it being the main tool to collect passive surveillance, so disease suspicions, disease notifications in a country. That's how it was developed. Of course, as with the world evolve, we're evolving together with it, and we're saying that there is no single tool that can provide all the dimensions of surveillance, and countries are using different tools. And with the move to One Health, also we are needing to integrate different surveillance activities as well. So the need for integration, the need for tools to work in an ecosystem of solution is top of our mind. We have ongoing activities to connect EMAi to the HS2, to AFIA data, which is community-based surveillance tool. We have several ongoing interoperability initiatives. There was a question in general about connecting to other tools in the country. So interoperability needs to be evaluated case by case in the moment, because we're still going towards that journey. And in parallel, we are also creating tools to make interoperability just a reality. For instance, creating a reference data service so that we tell you, this is how we store our data. If you want any tool to be interoperable to EMAi, you can do it from your own end. So there are several different work going on to make EMAi interoperable with specific tools, to make EMAi's data just robust in a way that can be used as a reference system in general. So interoperability is top of our mind, is what we're working towards. And what we're talking about here is helping a country collect different data that matters to do their epidemiological intelligence. So I'm doing this gesture because I'm thinking of the data on the field, right? I'm thinking collecting data from the field and then gathering it and generating epidemiological intelligence at the national level. That's what we're supporting countries with. Of course, countries then also do have a mandate to report data to WOA, and we want to support them in that process. WAHIS is a tool that WOA uses to manage their own data. So once country reports data to WOA, that's how WOA manage their data, is WAHIS. So those are things that exist in the same universe, right? But we're not talking about tools that necessarily connect to each other. So we're talking about helping countries collect data, integrate data, make sense of data, generate epidemiological intelligence, take decision. Then part of that country's job is to then report data to WOA. And because we've helped them collect all this intelligence, that job is going to be made much easier. Eventually, a direct connection, there is several steps there, many of which are not just technological, that can be looked into. It's also in our roadmap of development, let's say. But at the moment, our focus is in helping countries generate intelligence and take decision for action at country level. That will for sure facilitate all the work they do reporting that data further, but our focus right now is at national level.
Great. Thank you really for the clear answer, Fernanda. I see also Amy.
Ismaila, can I also jump in to complement a bit what Fernanda just said?
Yes, allow me to give the floor to Amy if she would like to add something, because I know she's really addressing this WAHIS system and the interaction, the difference between the WAHIS. Before giving you the floor again, Gisela, sorry. Give Amy, please.
Yeah,
I think you want to add something, yeah.
No. I completely agree with what Fernanda said, and I think she laid out that distinction really clearly. And I think we do just want to emphasize that we want to support countries in their reporting to WOA and to make that as easy and accurate as possible. But we also recognize that you're maintaining data in systems at the country level that would never be shared with WOA, right? That there's a certain level of data that flows, and there's other data that lives at the country level and is managed and used there for other reasons. And so this system is really at that in-country space.
Yeah, great. Thank you. Gisela, I will take that opportunity also for you really to address how national veterinary authorities can ensure long-term sustainability for EMAi. I think that's really something important, if you can also add that part. Over to you.
Sure. So I just want to say first, before answering that question, is to be clear, because I see some questions about about access of FAO to the data. Just to be clear that, as it was mentioned already, I think by Amy and by Fernanda, the tool is to be able to allow the country to get real-time reports directly from the field to their central level. And it is stored, this information, in a cloud that is managed by FAO, but we do not have access to it. Even though it's hosted, it's a cloud hosted in FAO, we do not see the data. We do not have access to that information. It stays within the country, because there are some questions about how FAO can visualize information. We don't have access to that information unless the country specifically gives us access, specifically shares with us the information. Otherwise, even though it's stored in the cloud in FAO, we do not have access to it. So for sustainability, this is one of the things that we discussed already from the onset when a country tells us that they would like to have EMA-i. So by beginning to check that it is relevant for the country, that it fits into their surveillance system, and it's not going to create extra work, overlapping work for them, and then figure out exactly where it fits into the system in a way that makes it easier for them to do their passive surveillance, to do their surveillance work. Beyond that, we train trainers in the country on how to use EMA-i. So those people trained in the country can then train the users of EMA-i in the country, and then you have capacity in country for EMA-i. Because also, as I mentioned, the server is an FAO, so we cover the fees for maintaining that server, to maintain the server where the information is stored. Often this is an issue that countries don't have a budget line for this, so this is something that is covered by FAO. And also we have a team of IT that ensures any troubleshooting issues are addressed to make sure that the system is always up to date. That would be an additional cost for countries as well, so that also helps ensure sustainability. And we have discussions as well with the country is how to ensure that regardless of any rotation of staff, that they will still continue to be able to have staff trained in EMA-i and have them aware of how to use it. And that is part of the discussion of in the implementation plan, sustainability plan with the country to make sure that is considered. And beyond that, it's also a conversation that we have, as Fernanda rightfully mentioned, is what other tools perhaps exist in the country that we need to see how they can communicate with EMA-i. So again, avoiding overlap, avoiding repeating efforts between the various tools in FAO.
Okay, thank you. Thank you so much. I think we are almost there. I know Madhur mentioned she need to be in other meeting webinar. I don't know, Madhur, I know you have the overview. You really would like to say a few words regarding the question and also provide some guidance. And also at the same time, before looking for the regional perspective with ECOWAS, if you would like to say a few words as a guidance and also kind of, yeah.
Thank you, Ismaila.
Closing, yeah.
Yeah, thank you. I'm afraid this is the slot where there are 3 simultaneous webinars ongoing. I just wanted to say that, you know, there are many questions that are being asked, and I'm not sure if we can answer all of them. So you have a generic email address. You can contact us for specific webinars, for specific answers, and we might even organize a follow-up for more detailed deep dive into EMA-i. As was already highlighted, you know, this is one application, but our goal is to help countries to be able to gather data, to manage data, and to use that data more efficiently. So EMA-i is just one small part of it. And through this webinar series, we are going to explore all the different aspects of the work we are doing to support countries in enhancing disease intelligence. I just wanted to say that I think it's great to have all the countries here. Thank you so much to everyone who has connected, ECOWAS. Our goal is also to enhance regional disease intelligence. So as you know, we're talking about data partitioning. So through the EMPRES-i platform, you can choose what data to share with your neighboring country, or with WAHES or with anything else. So there we are moving also in that direction, where a country owns that data and can choose which parts of the data to share with who, for regional intelligence, national intelligence, or interoperability with other systems. And we'll do a deep dive onto those topics later. So with that, I'm afraid I'll have to leave you, and I'll leave you in the good hands of Ismaila and the team for the rest. Thank you so much, everyone.
Great. Thank you. Thank you so much, Madhur, for really the good point raised on the regional dimension and EMAi, EMPRES-i as an entry point to address other surveillance and early warning system issue at national level. We are almost at the end of our webinar. I would like really to welcome Dr. Adekal, the Acting Executive Director of the Regional Animal Health Centers from ECOWAS, for him to give his point of view regarding the vision, how EMAi could support the regional collaboration, and also the related to the information sharing system. I know ECOWAS would like to establish the Regional Animal Health Information System, the RAHIS, and this platform, this system, how that can be used and involved on this one, how the regional economic communities can really contribute to that vision. I think it's really important if you can give us your point of view on that. Dr. Adekal, the floor is yours, please. You are muted. You are muted.
Yes. Good morning, everyone. Good morning, Ismaila. I would like first to really thank FAO and Ismaila and the team for the great job you are doing really for the West African region and beyond it, the global work you are doing. I would like to introduce myself. I don't know if everyone knows. People don't know me because I can see the list. I have to introduce myself. My name is Hassan Adakal. I'm veterinarian. I'm the acting executive director of the ECOWAS Regional Animal Health Center, which is based in Bamako. I would like first to talk a little bit on ECOWAS. ECOWAS is the economic community for West African states, which used to be 15 member states, and it's now time to start talking about the reducing of the numbers. You may know that we have now 3 countries exiting from the ECOWAS region, which are Mali, the Sahelian countries, Mali, Burkina Faso, and the Niger. This is yet to be concluded, but negotiations are underground. But it's clear that now we will have in the region two organizations. We have ECOWAS with 12 countries, and now the Alliance for Sahelian countries, which is IES, with Burkina Faso, Mali, and Niger. I'm stating that because it's very important. You know, we are a community, and we have mandate to harmonize in terms of policies and also all the strategies we are developing. As you may know, working on transboundary diseases and also on zoonotic, the boundaries you have between countries is very important, and these silent countries are really at the heart of ECOWAS. And having now 2 parts, it's something that we need to address. And it's time to start really thinking, being more intelligent to how we can really deal with without breaking one has been built so far as one entity. Saying that, I will really again come to say that we used to work with FAO in very, very good relation. I can say that we working with Swaila, with Boca, with the Garba, with Lafia. All these people really are our key partners. We develop our strategies, and currently with Lionel Bagidi, we are trying to develop the rabies, the HPIA also strategy at regional level. This is to say that really we are in close relation, we are aligned with what we are doing with FAO, and this is very, very important. We were in February in Gaborone, Botswana, and Fernanda was one of the key actors of this meeting we had on regional consultation to integrate information system in animal disease surveillance and intelligence. And what has been said so far is really the conclusion we come up on this issue, starting from the fact that we need as a institution to develop and have tools that can really help us at national level, the actors, the technicians to respond, and for the decision maker to really act based on the information they are having from the ground in terms of early warning information they can have. And we really have this conclusion that based on that and the opportunity we have as which is showed by digital technologies, we have this many tools that are developed by even at national level, but at regional and also at the global levels. We have these tools coming up, and EMA-i is one of these ones. And we have really the confidence that the support we are trying to give to this tool, and also the commitment we have with the countries that have used it in many, I think it's Ghana and also Guinea. The first results are really impressive, and we have the confidence that this is something that we need to push forward. Saying that, it's important also to keep in mind that it's based on the situation we have. We have countries now requesting for their sovereignty, and it's difficult now to come with a tool to say, okay, this is what you have to use, coming from the global level, and you need to. So I think this is something that we need to keep in mind at the FAO level and also at the regional level, that it's good, it's our challenge to really make the tool so friendly and so easy to use, so that it's not really by being behind people and requesting them just because it's the best tool, making the life of people easy. Because what we heard in Gaborone is from the technician is this cumbersome and also this overlapping work, duplicating work that they have to do, because they have to send information to WAHES and then to the regional level and then to EMPRES-i. Yes, they don't want to have this kind of situation. They want to have one entry where all the actors, all the demanders, they can take from this and use it as the main information coming from the countries. This is one of the important things we really have we discuss along. Coming now at the regional level, we are trying really to develop because we are confident that at the global level, the relationship they have is different from what we have with the member states. the more you are closer with the member state, the better you will have the data, and also the possibility to really make information more coherent from what we have on the ground. So we need to develop our regional system, which we call the Regional Animal Health Information System. We make progress, but we are yet really to have a system which is working, that we can share with the member state, and also to share at the global level. So this is an area where we need to continue working with FAO, see where we can really have this system in place, and then continue working with the member state together. I know that it will be difficult to stop because there's too much to say, but this is very important, that having the system will really change the narrative we have in the region, really. And yes, my point of view, and we can have the day discussing this, because it's something we need really to have at the region, and the member state to really conclude with this this problem of duplicating data and sharing information. So yes, we are here to respond to every question we have, and yes, we'll continue to work together for sustainability. Thank you, Ismail, for the opportunity.
Great. Thank you so much. Thank you so much. And thank you also for Gisela for putting on the chat the link for the question for the survey we are using for this webinar. Please, colleagues, take the time to address the 4 questions. It's on the chat before leaving. And I will take the opportunity just to highlight that we have a lot of questions and contribution on the chat that we will be happy to review, to look at, and come back to you for further details and to address the different questions. I'm seeing a lot of interest really on these topics. We will try to really reach out and further communicate and announce that soon as you will have the online course, the VRC online course on EMAi that will be developed, and we'll support you on the implementation of EMAi. And we have our VLC here online who will be really in close contact with you and try to see how they can support you on that. We will have additional communication plan to really see how we can support implementation on country. I see a lot of questions moving from old to the new one, the migration to do it, the other country to be involved, some of them to enhance and scale up the capacity we have. To announce that also we will organize regional training of trainers that will come soonest by the end of this year to better support you, give capacity to the region and the country to be able really to continue this implementation and scale up at national, sub-regional, and also at a regional level and global level. I think that's will be the final word from our side, to really thank each of you for joining. Please complete the form. We will be able really to come back to you for any question, if any you would like really to know about the tool, about the system. Some colleagues asking the costing. We will share with you the framework that was developed and with the different steps and also the costs involved to really support you on that one. And I don't know if we are on time. We are almost 5 minutes more than what we planned. I will thank each of you and see you soon. Thank you so much for really your participation, and please complete the form. And for any question, you can address to using the EMAi email to really follow up with you if any you would like some clarification on some aspect that was presented by Gisela. Thanks, Gisela. Thanks, Kauri. Thanks to the communication team and all the panelists for the really very comprehensive answer you provided. Thank you. Thank you so much, and see you.